My name is Lea Crown. I'm the Director of Health and Human Services for the City of Meriden. It's time for the weekly social media question and answers regarding COVID-19. So thank you for your questions. We received 12. As you are aware, COVID-19 is a rapidly changing situation, so always note that the information that I'm going to provide is the most current information as of April 7th, 2020. So the first question, any news on schools? There is no new update on schools, unfortunately. They are still scheduled to be closed per governor's executive order through April 17th, reopening on April 20th. If there are any updates, they will be posted on the Meriden Board of Education website, the City of Meriden website, and the Board of Education will communicate this to families. The second question, if you have had the virus, can medics tell you after you've recovered? So the current CDC guidance is to not test anyone who is asymptomatic or who does not have symptoms. So if an individual was suspected to have the illness, meaning having fever, cough, shortness of breath, they have recovered, most likely they will not be tested. The person should continue to practice good public health prevention measures, such as social distancing, washing their hands, and cleaning and disinfecting all frequently touched surfaces. The research, we still don't know if somebody can get COVID-19 twice. So please follow those prevention measures. The third question, is it okay to walk my dog on my street if I wear a mask? Yes, you can walk your dog. The fresh air will be very good for you and your pet. It is okay to walk your dog without a mask as long as you can maintain that 6-foot social distance from others. This is new from last week. So the CDC is now recommending that people wear a cloth face covering in public settings where other social distancing measures are difficult to maintain, such as at the grocery store or the pharmacy. However, though, masks are not a substitute for social distancing, so still maintain that distance. The cloth face coverings recommended are not surgical masks and they're not N95 masks. Those are still considered very critical supplies and they must be reserved for healthcare workers and our other medical first responders. Our fourth question, when are the numbers for recovery going to start being reported for Meriden and Connecticut? On the COVID-19 dashboard, it still shows 0 for Connecticut recovered. I'm not sure which dashboard you're referring to. I'm going to assume that it was the one created by UConn, which lists the total number of confirmed cases, the number of cases increased from the previous day, and total deaths. Currently, the Department of Public Health is reporting this same information. We can assume that those who have not died from the illness are somewhere in their recovery. The fifth question, can you share information about the large apartment buildings in town, such as Hanover and Harbor complexes? I have been in direct contact with the Meriden Housing Authority as well as Carabetta management members, providing the most up-to-date CDC guidance for cleaning and disinfecting frequently touched surfaces and implementing social distancing measures on the properties. Some of those social distancing measures including limiting visitors that come in and see people who live in those complexes, as well as closing common areas of the building and increasing the frequency of cleaning and disinfecting of the frequently touched items, such as doorknobs and elevator buttons. They have also received bilingual public health materials on COVID-19 that should be displayed in their lobbies. So the sixth question, what advice do you have for use of masks in Meriden? So we kind of touched a little bit on this before, but in light of some new research on the virus, as I previously mentioned, the CDC now recommends wearing a cloth face covering in public settings where the social distancing can be really hard to maintain. There are instructions on how to make one of these cloth masks on the CDC website, as well as instructions for cleaning and washing those masks and how frequently that should be done. However, I want to emphasize that the cloth masks are not a substitute for social distancing, so please still maintain that 6-foot distance between you and others as much as possible. I do also want to mention about masks that the cloth face covering should not be placed on young children under the age of 2, anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Again, the cloth face coverings recommended by the CDC are not N95 masks and they are not surgical masks. Those types of masks should be reserved for our healthcare providers and other medical first responders. So question number 7. Any research on how long the virus lives on paper, plastic, etc.? Do I need to wipe down groceries or my mailbox? So the CDC currently states that the new novel coronavirus may remain viable for hours to days on surfaces made from a variety of materials, and it really depends on what that material is. However, it is important to understand that being alive on surfaces is not the same as being infectious. At this point in time, we still do not know if the virus is infectious on surfaces, and if it is, how long it remains infectious. The main mode of transmission for COVID-19, remember, is person to person through respiratory droplets. The good news is that this and other coronaviruses are easily killed when proper disinfection practices are followed. This means cleaning surfaces first with routine cleansers like soap and water to remove dirt and grime, and then applying a disinfectant listed on the Environmental Protection Agency, or EPA, their List N, it's called. These are a list of disinfectants approved and effective for use against the virus causing COVID-19 disease. It's very important to follow the label directions properly on how to apply it and how long it must remain on surfaces in order to work. And there is that list N is available on the CDC website as well as the EPA website. I would encourage everyone, however, to wash your hands after you put your groceries away and after opening your mail. It's just good, regular public health practice. So question number 8, what is going on with the Westfield facility? Are there any dangers to surrounding neighborhoods if the facility becomes concentration of COVID-19 patients? What filters will be in place to prevent the virus from being spread outside the facility and into areas close to the facility? So I actually had an hour-and-a-half phone call today with the Department of Public Health regarding long-term care and assisted living facilities and the COVID-19 response. So according to the Department of Public Health, they are still solidifying roles of COVID-positive facilities. This should be done this week. That's what they say. The vacant Westfield Apple rehab property has been identified as an overflow location by the state. So the Connecticut Department of Public Health reports that COVID-positive individuals from hospitals will be moved to facilities such as Westfield in an effort to decompress the hospitals. So this is part of their surge plan. This facility will be staffed by medical professionals who will follow infection control practices to spread the disease. As of right now, April 7th, there are no patients currently at the Apple Rehab facility. Question number 9, will the city release the age and demographics of the positive cases here in Meriden? And the answer is yes. We are putting that data together. We will be releasing just age and gender of the positive cases only, no addresses or no other identifying information. These will be posted on the city COVID-19 webpage and also on our Facebook page. So look out for those daily, most likely starting tomorrow, April 8th. So the question, the next one, number 10, why do some hospitals take up to 6 days to get COVID-19 test results back and Trump gets his results in 15 minutes? So the length of time of test results can vary depending on the facility where the test was done and then also the lab where the test is sent to. Right now, the state public health lab and multiple commercial labs and hospitals are testing for COVID-19. However, I can report that faster tests are being developed and will hopefully be available to our community soon. Question number 11, can you catch the virus from a mosquito? So at this time, the CDC has no data to suggest that this new coronavirus are spread by mosquitoes or ticks. I also looked that up. The main way that COVID-19 spreads, again, is from person to person. The last question, is it safe for my child to swim with a friend in our private pool? Normally I would say yes, but during this COVID-19 pandemic, I would really discourage any unnecessary visitors to your home. So this unfortunately means no play dates. We encourage people to stay home and stay safe. So those were all of the questions we received this week. As always, if you have additional questions, please feel free to reach out to me at the health department, or you can Facebook message us as well. I try to respond as quickly as possible. So thank you for your questions. I want to emphasize that we will get through this. I know it's a really difficult time and it's a very stressful time for all of us. However, we need your help in making our community a safe place to live. So please, please, please practice those public health prevention efforts such as social distancing and hand washing. They're really simple and they really do work. So please stay home and stay safe. Thank you.